Namaskar and welcome to Apollo 24/7's Health Hour. Health Hour is a show where we bring you experts from Apollo hospitals to this live platform where you can type your query in the YouTube chat box and the question will be answered by our expert. You must be watching this on our Facebook or Instagram platforms as well. But if you want your query to be answered, I request our viewers to hop on to the YouTube chat where you can type your question in the chat box with all your details possible like your name, gender, किसके बारे में आप पूछना चाहते हैं or as much detail possible. And today we are going to talk to an expert who's going to give you answers. In a short while, I am going to invite our expert today. But on the show, we are going to have a health quiz. Same question हम आपसे पूछेंगे and you get a chance to win prizes from Apollo 24/7. And also, I'm going to share some discount vouchers and coupon codes that you can use on Apollo 24/7 as well. Download the app and get entire benefit of having Apollo Hospital's facilities in your hand. तो चलिए आज का टॉपिक बात करते हैं. We're going to talk about ovarian cysts. So, what are these ovarian cysts? How are they going to impact a woman's life? What is the treatment and management? We're going to talk to Dr. Monika Meena, who's a robotic Gyne Onco surgeon from Apollo Multispeciality Hospitals, Kolkata, with experience more than 12 years plus. Ma'am specializes in the treatment of gynecological diseases and conditions and gynecological cancers as well. And she's the first female gyne robotic Da Vinci certified surgeon in Eastern India and one of the highest experienced in minimally invasive gynec surgeries and robotic surgeries. She's the alumni of the prestigious institutes like AIMS, New Delhi and JIPMER, Chandigarh. And she is a professional member of Association of Gynecological Robotic Surgeons, ESGO, IMA, FOGC, and also WALS, that's the World Association of Laparoscopic Surgeons. Let me now welcome Dr. Monika Meena. Good morning, ma'am. Welcome to the show.
Namaskar. Thank you, Ms. Jhansi, for the brief introduction of mine. It's a pleasure to be here interacting with the live audience here.
Great,
So,
ma'am. Thank you so much for
yeah,
honoring and being here on this Sunday platform. We understand Sundays are precious for you, but you're here for our audience and we value that time.
so it's always great to interact with the audience regarding the health issues and the topics which can actually be beneficial for the females per se. So,
True, ma'am.
yeah, let's head
But
it on.
as I understand, health in general is gendered. Healthcare is also gendered, especially in our continent, in our country, and parts of India, especially urban, mein, rural, mein, even more. So, female health, till the time that they're married and they come to a gynecologist, takes a back seat. It's not priority. Even then, the childbirth gets priority than other health. So, in that scenario, let's talk about ovarian cyst. While ovarian cyst is so common and it's a major, large, it's affecting a large number of population, we do not have much of information outside. What do you think that, how do we address this issue, ma'am?
Yeah, Jhansi truly said that females are the main, they are the mainstay on the of the family system who takes care of everybody in the family, just neglecting their own health at the back end. And the minor issues may be just like a discharge or just a pain, menstrual irregularities. They just consider to be, just ignore it and just keep on working and doing their household duties, or maybe on the work front now because everybody is now getting on the work front as well. But many a times these minor things, these minuscule symptoms and signs which they have been suffering from, ignoring time to time, they do lead to some catastrophic events in the future. So, not getting onto the details of cancers and all, but we'll talk about ovarian cyst. So ovarian cyst per se, it's actually very common in the ranging from the age group of reproductive age group ranging from menarchal females from like 15 or 16 till the menopausal, that is after 65 years of age as well. So it covers the broad range of practically all the female patients we encounter in our OPD. And these are somehow the cyst these days, because everybody is so aware of the health issues and everything, so they are incidentally detected on the ultrasounds because of the routine health checkups and the the routine health programs that they underwent and take up the examinations for. So on the ultrasounds there are now more pickups of some ovarian cyst which may be asymptomatic as well. Now, talking about the incidence of ovarian cyst, it is like range from around 8% to 25% in all the females. That means if we encounter 100 females, so approximately 8 to 25 females might develop or may have a cyst in her whole lifetime.
Right, ma'am.
So
So
it
there
again
are
emphasizes the fact. Yeah.
Yeah. So I see our audience are joining in good numbers today, and a lot of women have joined. I urge all the women to please go ahead and type as much detail as possible. Mehek, thank you for putting all the details in your chat. So I request any woman who's going to ask question to put your last period, cycle ka history and everything possible, so that ma'am can answer much better. And also, if men, you are also watching the show, please do talk about it. It's not just a woman's problem. I urge all you men to understand more about it and see how you can help the women in your life as well. So, Dr. Monica, I have one question here. How do we understand what a ovarian cyst is and what it does? ओवरी हमें पता है कि एक अंडा रिलीज करता है या दो अंडे रिलीज करता है एवरी महीना, बट ये सिस्ट होने के नाते के कारण क्या होता है एंड उसे कैसे डायग्नोज करें? दैट वाज माय फर्स्ट क्वेश्चन.
Yeah, so ovaries, as you know, that it's an oval-shaped gland per se, which are present in the either side of the uterus or the बच्चा दादी जिसे हम बोलते हैं जिसमें baby आता है. So those egg or glands, I mean the ovum or the ovary, they actually have millions of follicles in the lifetime of a particular female, and eventually only hundreds of them mature to produce eggs. So this is a system which goes every month, which we call as the menstrual cycle, and the in a perfect 28-day cycle the eggs are released on the 14th day from the ovary. So in a layman's language, ovary is used to produce the eggs, which if fertilized by the sperm will help us to conceive or produce children in future. Apart from this, ovaries do produce hormones such as estrogen and progesterone, which are very important for the well-being of the female overall, as well as in the menstrual cycles, in the process of conception, in the general women's health. So what happens is, if there is any hormonal imbalance setting in because of these hormones I told, there is a formation of a cyst like structure inside the ovary, which could be just filled with a fluid or watery material, or it could be solid. So these cysts are formed. Now, most
Yes.
of the females, I would say, like if you have 100 females with cyst, approximately 30% will have just the functional cyst. Functional cysts are something which go off there on your own within some time, maybe maximum 1 to 2 months of the duration. And these cysts are actually formed by the normal process of ovulation, which I said. The ovary gets ruptured to release the egg, and because of that rupture there is a follicle which is left behind. So in some of the females that may enlarge and is depicted as follicular cyst. So for the most common entity of the ovarian cyst, that is the follicular cyst, nothing needs to be done.
Okay.
Then comes the functional cyst I was saying. Then comes the follicular cysts or the polycystic ovaries, in which we have multiple cyst formations. These are the cysts which are formed because of the non inability of some follicle to release the egg. That is, the follicles are forming, but egg is not released. That cycle is anovulatory, or she is not releasing the eggs. So that is not a fertile cycle. You will not be able to conceive in that particular cycle, which may happen in every female. Now, this kind of follicular cyst, or the conditions which we call that is the polycystic ovaries, they are the conditions in which the cyst are formed, in which the eggs are not being released, or an anovulatory condition sets in. That most commonly occurs because of the hormonal imbalance which I was mentioning. So this hormonal imbalance, again, is a direct cause because of the bad eating habits, as in nowadays most of us are prone to having junk, cold drinks, processed foods, burgers, pizzas, noodles, everything. And less foods of like fruits and vegetables, which does not have much of antioxidants. So they ultimately adds on to our belly fat, and more of a fat gets converted, leads to the hormonal imbalance, because of which there is a array in the female hormonal balance system, and the male hormones take a slightly upturn as compared to the female's hormones. So this leads to multiple problems which happens in polycystic ovaries, which we can talk about. And some cyst, ovarian cyst, could be because of the cells. There are multiple forms of cells in the ovaries. So they lead to the formation of maybe dermoid, in which multiple, you can see tooth is there or a hair follicle is there, which is not cancerous though, but it needs to be treated because it may cause some complications, which we'll eventually talk about, I suppose. And then I would
Yeah.
say 10% of them are which may lead to ovarian cancers eventually in the future. So this is
Right.
the gist of an ovarian risk, I mean the cyst which are being formed.
Which is
um,
so important that ये हमें बताया नहीं जाता है. जिसको प्रॉब्लम है वो अपने खुद के इंटरेस्ट से पता करते हैं, इंफॉर्मेशन गैदर करते हैं. विच शुड बी
exactly,
लाइफस्टाइल पे ध्यान रखा करो, पीरियड का रेगुलरिटी पे ध्यान रखा करो, एंड देन व्हाट यू ईटिंग एंड हाउ इज इट अफेक्टिंग योर
that
बॉडी.
is
ऑल दिस इज वेरी important. Yes, ma'am,
that is
as you
very
were
important.
talking, yeah, you were talking about PCOD and PCOS, and I see Sonia, Shivani, then Shreya Bhattacharya, Mehek. All of these women are talking about PCOS and PCOD. So I will take one question after other. Most of them are similar in nature, but I will read out all their questions and so that you can answer in one go.
Yeah.
Mehek का question मैं पहले लेती हूँ. Good morning, ma'am. I'm 24-year old, and since my first period, since 2013 till now, I've not got correct and proper period नहीं है. I've been diagnosed with PCOD, and maybe once a year भी period उनको आता है, but जब भी आता है बहुत painful period आता है. So I have been to काफी सारे doctors के पास गई हूँ, but I did not get proper results. Please do suggest something. This is her case. And the other case is Shreya Bhattacharya, who's been suffering from PCOD for 6 years. How can I cure it? Then comes Shivani. Shivani is also 25-year-old. I have PCOS for 5 years from now, on and off birth control all this while. Is losing weight only solution, or do I need to have other medications? Then Sonia has 29-year-old. I have PCOS from many years. Recently started taking treatment with Yasmin, again birth control pills, but I still did not get my period. So I have placed too many questions before you, but all of them are related in one way or the other. So let's start with Mehek. Mehek का issue है कि that she has not got her period. अगर आता है तो 1 year में एक बार आता है, but अब तक उसको सही solution नहीं मिला है.
Yeah, so many number of S who are suffering from PCOD, it appears. See, polycystic ovaries are this is a condition which we encounter in our OPD. Approximately 30 to 40% of the unmarried females comes to us for PCOD per se. So the main problems in PCOD would be the irregular periods. That is, they are getting periods every maybe 2 months, 3 months, or maybe further late. The second thing is weight gain. Usually the PCODs, they are slightly on the higher side of the weight. The third thing is they might experience multiple acne or pimples, what we call. So they'll be suffering from pimples every now and then. The fourth thing is they might be having problems with excessive facial hairs or the coarse hair which are developing over the face, or maybe on the under the arms, on the thighs, on the axilla, armpits, etc. So, and the fifth one is they will have complain of excessive hair fall. So these are the most common complaints they do. Now, most of the times, if the periods irregularities are not there and these symptoms which I have mentioned are not that much, then this can be taken care of just by the lifestyle modification technique. lifestyle modification, by that I mean that you need to have a good sleep of at least 8 to 10 hours. That is very important, because most of the females we experience in our OPDs, they have the erratic lifestyle, because they might be working in the night shifts and working on computers or work from home sort of things, so there is no mobilization here and there, and just their long standing long sitting hours are there. So good sleep is important. The second thing is, I need to emphasize on the diet. The diet should contain of a good antioxidants in the forms of much of fruits and vegetables, no processed food. I mean, it's very difficult to avoid it completely, but yeah, you need to cut down on the processed food or these junk foods, these beverages and all those stuff. And the healthy portion of diet is very important, that should have carbohydrates, proteins and everything. Now again, for the weight reduction, we ask these females that, the amount of rotis or the rice they are taken, if they can substitute that by increasing the amount of dal or sabzi, or the meat whatever they are eating. So if they can increase that portion as compared to that carb portion, that will actually help them to lose weight or be in good shape as well. The third most important thing I would say is exercise. So it's very important, from not only from this polycystic ovary or anything. I mean, it's very important that you are in good shape and you're physically active doing exercise. So to begin with, for the newbie, they can do 30 minutes of brisk walk in the morning to start with. That's a good idea. Now, talking about the problems that they have mentioned about the periods, I would like to emphasize that in case the periods are not happening from 21 to 35 days, if the periods are occurring less than 21 days, or if it is occurring after 35 days, it requires a definite treatment. So for someone who is getting periods just once a day, once in a year or twice in a year, it's not a good idea. You should seek your gynecologic advice as soon as possible, because you definitely require treatment for the same. Holding your
Yeah.
periods more than 3 months will pose a implication in the sense that you might be prone to develop cancers in future. So you require some treatment from that point of view as well.
Yeah. Ma'am, here, while you're talking about the treatment point, Shivani has been taking young children, they fear taking these birth control pills, thinking that, हम लोग अभी शादी नहीं हुआ है, मैं birth control pill क्यों लूँ? So that this is one of the treatment measures that we hear about काफी
Yeah.
सारा सुनते हैं. But on and off लेते हैं, ये treatment discontinue भी कर लेते हैं. So, what are the risks and of continuing or discontinuing treatment?
So, see, it's again a subjective thing that we need to assess from patient to patient. हर फीमेल में वेरी करेगा कि उसको कितना hormonal pills या जो birth control pills we are talking about कितना duration के लिए चाहिए, depending upon the response she gives us. Now, that is why I need to emphasize on the fact that once you are on these birth control pills, do not ignore that you need to stay fit, as in taking care of your lifestyle, exercise and diet as well. So that will actually help to wean you off from those pills, and your body will be able to take over with this hormonal imbalance once you have been treated for the time being. So we are giving these hormonal pills to correct your hormonal imbalance. In the meanwhile, your body takes over once your lifestyle is good enough to take care your hormonals perfectly.
Yes.
So
So, Shreya Bhattacharya,
depending
I
upon
think
the
you're
response, we need to continue.
correct. So, yeah, Shivani's question was around 5 years से वो pills ले रही है, 25-year-old है, and all this while, is losing weight the only solution, or are there any other medications than these birth control or hormonal pills?
See, there are medications which are available which helps you to reduce weight as well. But again, 5 साल आप अगर hormonal therapy ले रहे हैं and it has been too much for you to take, then just imagine that taking other medications for weight control, for there are medications available which change causes the change at the molecular levels so as to change the process of PCOD. But again, it requires treatment for a longer time. So these are only the alternate option. Ultimately, once your body is a fitter you, then we'll be able to wean you off from these medications. So of course, losing weight, not only losing weight but becoming a fitter you in the form of doing an exercise, good lifestyle, taking adequate sleep, be more aware of your symptoms and everything, reaching out to your doctors if the need be. Everything in and all is required. So taking off from these hormonal pills, you need to take care of these all together, not only losing weight, but everything needs to be done. Then only
Yeah.
the medication can be cut off.
Yes, and in the same context, मैम सोनिया सोनी पूछ रहे थे, वो 29-year-old PCOS के साथ काफी साल है. रिसेंटली वो यास्मिन शुरू किया है इन्होंने हार्मोनल पिल. 21 days हुआ है, पर अभी तक मुझे पीरियड नहीं आया है. तो पीपल आर एंशियस वन एंड दे वांट इमीडिएट रिजल्ट्स. तो ये हार्मोनल पिल्स हम जब लेते हैं तो व्हाट डू यू कीप इन माइंड, हाउ डू यू टेक दीज पिल्स? डर भी रहता है, एंजाइटी के साथ थोड़ा डर भी
Right,
रहता है.
right. Right.
So,
So that's what I was saying, that depending upon the symptoms, अगर हमारे symptoms ज़्यादा severe नहीं है तो I personally don't start them on these birth control pills until and unless you have that irregularity of the periods per se, and these acne and hirsutism is that severe, we'll put you on these birth control pills. Now these birth control pills have also evolved over the time. Initially we used to have the higher doses of these hormones, and now we have the newer generation ones where the ratio or the doses of the newer hormones are pretty less. So the side effects associated are significantly lesser as compared to the previous higher doses generation birth contraceptive pills. So they are, see, if your gynecologist is prescribing you any medications or these pills, they have see, every medication has some amount of side effects, but then they are relatively safe, and you are in a dire need of taking those medications so as to correct your these symptoms. So again, I know it is very difficult taking it on and on, but again, if the simultaneously lifestyle modification remains the mainstay, if you are working on that front, then possibly you will not require to take it on for longer duration of time.
yeah. And once the birth control pills are on, and will the period be regularized? जैसे ये सोनी जी पूछ रहे थे कि
बिल्कुल.
उनका पीरियड अभी आया नहीं है.
Huh, so that is what I'm saying. She needs to be evaluated from some hormonal profile needs to be done, because what she has received is Yasmin per se. So we need to examine, I mean, we need to have some more details about her ultrasound, her endometrial, I mean, the thickness in the uterus, and some hormonal profile needs to be done before judging that possibly there might be some other problem as well. Or usually it takes
Right.
7 to 10 days after stopping of the medication if she's taking for the first time to get her periods.
Sure, ma'am. Thank you so much for that answer. Next question is from Rekha Shanmukh. So I'm facing a problem that if I eat non-veg, milk, or any dairy products, my face is affected by hyperpigmentation, and I have done a hormone test. I have some LH imbalance. What should I be doing?
See, usually, if I mean, the solution, that you have actually handpicked those food items which are giving you troubles, like milk or lactose items, or the fat, I mean, the meat, the non-veg items, etc. So the best thing is to avoid them if you yourself has noticed this thing. But just the LH, I mean, we usually don't look upon the LH per se as the marker, but we usually see the ratio of LH to FSH. So in PCODs, the ratio of LH to FSH, that is the luteinizing hormone to follicular stimulating hormone, increases more than 3 to 1. So we need to look upon the cumulative hormone assay, as well as the other hormones of like thyroid and prolactin hormones in you. And if I don't suppose, I mean, you haven't mentioned about any menstrual irregularities if she's having. She
No,
just mentioned
no,
about the
she's not.
hyperpigmentation, what
Hyper-
she's referring to. So
yes, ma'am.
there might, yeah, so there might be some other issue as well as setting in. I mean, because of some allergic to some component, maybe the lactose part of the food stuff.
Yeah.
So that could
So
be the
while we're
issue.
talking about diagnosis, ma'am, there were two questions about how do we understand? इसके कोई signs and symptoms होते हैं क्या? And that was the first question. And second question, who's a registered user question is the ultrasound the only way to understand or find out an ovarian cyst?
Yeah. So, yes, as I told you, most of the ovarian cysts are asymptomatic. They don't cause you any problems, and they are incidentally diagnosed on an ultrasound while doing a health check for maybe something else, and you got to know that you have an ovarian cyst. So most of the times we don't do anything about it if the size is small and it is not causing any problems. So any cyst which is larger than 4 centimeters, and the characteristics, there are typical characteristics which we look upon on the ultrasound, which might require treatment per se. The signs and symptoms, as you are referring to, that what could be the signs and symptoms, are the generalized signs and symptoms which a female could have. She'll have symptoms only if the size of the cyst is more or it is larger. For the usually for the smaller cyst you don't have any problems, but for the larger cyst you might have pelvic pressures or pain abdomen. The lower pain abdomen would be there. You sometimes the cysts are associated with infections, so you might have white discharge per vagina with itching, and again the pain abdomen. You might have abnormalities in your periods, maybe, as I said, anything, if you're getting periods within 21 days or if you're getting periods beyond 35 days or so, that needs to be taken care of. This is not to be ignored. So anything between 21 to 35 days is okay. Beyond or lesser than that, we need to address this issue. Then you might have some non-specific symptoms like bloating, nausea, vomiting. This is actually this thing that even in the ovarian cancers, most of the time females don't have any symptoms. When they present to us, they'll just have nausea, vomiting, or something like this. And the c ovary is actually a silent killer that ways. But these are the symptoms. If they are there, then please contact your gynecologist, because they might require timely intervention and might be don't
Yeah.
require any treatment for the same.
Yes, ma'am. That is being silent. It doesn't mean that it is not a threat to health. Can an ovarian cyst
Exactly.
lead to an emergency as well, ma'am? Is if it is not found, if you're not treating it, can it cause an emergency as well?
Yeah, that's a very great question, Jhansi. Yeah, ovarian cysts do pose an emergency. Now, usually the cyst larger than 4 or 5 centimeters in size, and they have a fluid or any content, light content. So what happens is the cyst which is formed, it might just get rotated or twisted on its axis from which it's connected. It is getting its blood supply. So the ovary gets torsion, what we call as a torsion ovary. So because of this torsion, she'll have the female will have excessive amount of terrible pain, and if the blood flow to it is compromised, her pain will be suddenly get relieved, but that ovary would be good for nothing then. I mean, the blood supply is totally cut off. So this is it's a complete emergency situation if such kind of pain or something torsion happens and it requires surgery there and then. We need to take out
Yeah.
that cyst there and then and detwist the ovary so as to
So
salvage the ovary.
like how appendicitis का pain जो हमें बताया जाता है
Exactly,
कि यहाँ पर
exactly.
आता है.
बिल्कुल.
Yeah, are there locations and specific kind of pain that you need to look out for if it's concerning ovary?
Yeah. So appendicitis is again a differential for this. So usually in the right iliac fossa, the sideways, right or left iliac fossas, these are the areas where the ovaries are located. So if you have a severe pain associated with vomiting and something, ovarian torsion is one probability. Then, but if it is in the right side, appendicitis again is a differential for the same. So
Yeah.
this
So
is there.
same
The
location
second
was it
complication,
right and left? Yeah, right and left पे
yeah,
कहीं भी
both
हो
side
सकता है.
because we have two ovaries. Yeah. Yeah.
Okay.
The
So
second complication, maybe it might just get ruptured, or if it burst out, the contents may be released in the peritoneal cavity, will have severe pain. It might cause infection. If there is a blood inside, it will cause hemorrhage. There is really bleeding in the peritoneal. So that again becomes a semi-emergency, emergency situation in which we need to tackle with the patient by the means of surgery.
okay, okay. So these are either emergency situation होता है, your pain unmanageable होता है, immediately emergency के पास जाना होता है, but they
बिल्कुल.
can be silent as well. This is like two poles apart. Either
Yeah.
emergency होता है ना तो कोई sign भी नहीं होता है. This is strange and actually very typically. So keep
Emergency
us
तभी
what
होगा अगर the size is bigger.
correct, ma'am.
So it grows in
Yeah.
size. That is what causes the emergency usually.
Right. So next question is Sunaya Mahajan, 30-year-old female. I have an ovarian cyst of 8.8 and 7.5. Okay, 8.8 by 7.5 centimeters dimension since the last 3 years. Should I get the laparoscopy done as it is not bothering me in any ways?
So, as you're mentioning that it's over the 3 years, you are aware of the fact that you are having ovarian cyst. Now, I would like to know whether the size is increasing or not. Though the size in itself is quite large, 8 centimeter is quite large, and because of the increase in size, the threat you have is it might give the pressure symptoms, as in the location of the cyst might give you the pressure on the bladder, or if you press it upon the ureter which is draining the urine from the kidney, it might cause stasis in the kidney, eventually leading to the pooling of the kidneys and causing problems with the kidneys. So keeping this larger cyst inside is usually not a good idea, but then I suppose some tumor markers, CA-125 levels must have been done in your case, and I presume that it is negative. That's why you are continuing with the expected management. But this large amount of cyst, I would not suggest just sitting back and relax, because you are kind of sitting on a catastrophic event. I mean, it might rupture anytime. It might just torsion might happen. So this is quite big cyst actually. But
Yeah,
we would
yeah.
like to know more details about the same.
Yeah, ma'am. She is here. I've been looking while you are talking about. So उन्होंने फिर से
Yeah.
थोड़े reports भेजे हैं. 30-year-old, I got my test done recently for left ovarian cyst, and inhibin B value was 202.35. That's the only detail I have, ma'am. Any other details that we want, ma'am?
See 125 level, sorry, I missed upon.
Inhibin B value was 202.35.
No, CA 125 was not done in her case. I mean, she's talking about a
I'm not.
cyst. So
Yeah,
why
CA
was her inhibin
125.
levels done in her?
हाँ
Is it a
हाँ.
solid kind of tumor? If it is a solid kind of tumor, then you need to take it out as soon as possible, because I'm presuming if you have gotten inhibin levels done, inhibin levels are usually done in granulosa cell tumors, which are the solid tumors. So
Okay,
I'm
okay.
not sure why other tumor markers has not been done. I mean, the ultrasound needs to be checked before getting onto it. I mean, what
ठीक
kind
है
of
एक
cyst
काम
is
कर.
exactly it is?
I think this is not the platform where we can discuss in detail.
Exactly.
महाजन जी, सुनैया महाजन जी, डॉक्टर मोनिका मीना जी का हमने लिंक चैट बॉक्स में दिया है, जो अपोलो 24/7 में भी आप उनसे कंसल्ट कर सकते हैं. And do get in touch because your case requires more detailed investigations. Thank you there.
Exactly.
Ma'am, next,
Exactly.
yes, ma'am. Next question हम लेते हैं, ma'am. Devika Sandra. I was first diagnosed with thyroid, and all of a sudden my symptoms were getting worse, and doctor suggested some tests, and I got to know I have PCOD. And now again, I can see that my thyroid function is going back, worse, getting worse.
Normal.
So are these two
Okay.
interrelated, ma'am?
Yeah, actually, see, the basic hormonal profile which we get done in the menstrual irregularities is thyroid, prolactin, LH, FSH, and some DHEAS for the androgen hormones and all. So, thyroid is directly related to the overall being of a female or even in the males, but it do affects your menstrual irregularities. I mean, your menses is largely affected by the thyroid and prolactin levels. So any abnormalities happening in the thyroid hormones will eventually lead to the menstrual irregularities. So what happens is, if we find such kind of irregularity in a females within the thyroids, we first treat them on the lines of hypothyroidism, or the treatment of thyroid is given first, and then maybe we might need to give them birth control pills if the PCOD is also there in them. So again, as she's saying that the thyroid hormones is getting worse, it's not because of PCOD per se. Again, it's a vicious cycle. Thyroid is also related to the obesity, the weight gain, the extra fat which is being deposited here and there, especially in the abdomen. That gets converted into the male hormones and eventually causes the disbalance between the male and the female hormones, leading to the irregularities. So even the
So ये
thyroid
दोनों
hormones
connected.
are affected because of that. Yes, of course. So
एक
it's
के
a
बाद एक.
vicious cycle. The weight gain leads to PCOD, and PCOD leads to weight gain. So it goes on and on. So
तो
you cannot,
मेरा
the weight gain could be a culprit to PCOD and a sequence of it, the same. So
wow,
you need
that
to
is
take
interesting.
care of both, I mean, for this.
Yes, ma'am. Next question is from Tamanna Bano. Good morning, ma'am. Please give details about hemorrhagic cysts and the treatment. आपने पहले functional cyst के बारे में and then follicular cyst के बारे में बताया था. What is a hemorrhagic cyst, ma'am?
Yeah. So hemorrhagic cyst is nothing but see what happens is whenever when ovulation happens, the ova is released from the surface of the ovary and there is a follicle left behind. Now, this follicles, I mean, this sort of in a normal menstrual cycle, the cyst left behind is called this releases a hormone which is called a progesterone. So if fertilization happens or if the sperm get fertilized with the this egg which is being released or pregnancy is happening, this cyst left behind forms a corpus luteal cyst, and there is a formation of the progesterone secretion from this, and the corpus luteal cysts are formed. But if the pregnancy never happens, the cyst gets ruptured and there is a formation of blood inside. So blood will be released. Some amount of blood is always released from this cyst. And if this blood is there inside the cyst, it forms the hemorrhagic cyst or forms cyst. Then there is another entity which we call as the endometriosis cyst, which is again there is a blood inside the cyst, which most of the times are the menstrual blood, which is being filled inside the cyst. So which we call as endometriotic cyst. So there are two cysts, which are the hemorrhagic cyst and the endometriotic cyst. Now, hemorrhagic cyst, most of the times, if they are smaller in size, they do get resolved on their own. But again, if the size is increasing, if there is symptoms associated like severe pain or something, we need to give the treatment for the same. The
Okay.
endometriotic cyst, on the other hand, is simply the menstrual blood which actually gets refluxed or gets inside back from the uterus and gets deposited on the ovaries or the ovarian surface or many places inside the abdominal cavity. So, if it gets accumulated inside the ovary, it forms endometriotic cyst, which is again a blood filled cyst, but that blood is old blood. It is not a fresh blood. And this cyst needs definitely usually requires treatment because it is very it causes severe amount of pain during the periods, during while passing urine. If you have endometriosis, it's a very painful condition. It requires, most of the times it requires treatment in the form of medical management or the surgery if the size is again bigger. So
Right.
as we are talking about the hemorrhagic cyst, usually the smaller ones get resolved on their own, but if they are larger ones and if they're causing symptoms, we'll need to give some medications.
Right. Thank you so much for the information. And Tamanna, thank you so much for asking that question there. My next question
Yeah.
is from Lakshmi Rajesh, who's a 40-year-old female, and she has small intramural fibroid in the posterior fundal region. Size is 12 by 6 mm. Is that okay, or do I need to be worried about it? And her periods are on time, 30-day cycle, 70 kilos, weight, she's active.
See, usually the intramural fibroids that small in size does not cause any symptoms. And as far as you are not symptomatic, we need not treat you for the same. But again, it requires an observation or expectant management in the form of, we need to do serial scans to see if the size is increasing, or if you have symptoms, then you might require treatment for the same. But as of now, what it appears, it is nothing needs to be done.
Yeah, so Lakshmi Garu, right now you can relax, and but it doesn't mean that you should not keep
Yeah,
an
it
eye
ends
on
here.
it. Yeah, all the women I would request, Lakshmi Garu, and any other person who has shared their size and all. Once you know that there is some change in your body, it is always good to get your tests done regularly to keep a monitor even before you visit your doctor. Dr. Monica, would you want to reiterate on this fact, because it never is enough to reiterate to keep a check.
Yeah. Yeah, that is definitely true. It is very important that you should be aware that certain signs and symptoms are not to be ignored, but you need to seek timely help. You are there taking care of your loved and near ones, but then when it comes to you, it is very important that you reach out for the timely help so as to help us diagnose your situation or whatever the condition is. Many a times it does not require any treatment, but if it requires, and if we can catch the disease at an early stage, then we'll be able to help you out better. So even when we say prevention is better than cure, then seeking timely help is all the more important. So definitely
Yeah.
prevention is a thing, but then if you have symptoms, don't ignore. please reach out and
Yes.
seek timely help for the same.
या खुशबू जॉन सिंह जी, आपने हेमरेजिक सिस्ट के बारे में पूछा है, अभी हमने उसके बारे में बात किया है. सो आफ्टर द शो, the show would be left in a recording. You can go back and see that as well if you've not got your answer. नेक्स्ट इज आशंक श्रीवास्तवा. इनका क्वेश्चन है, 40-year-old है, लेफ्ट ओवरी इज नॉर्मल इन साइज एंड शोज अ cyst with low lying internal echo of the size 3.2 into 2.5 centimeters with no internal vascularity. Hemorrhagic cyst है, periods are regular. So does she need to get any surgery done?
For the cyst, 3 centimeters in size, of course, it's a hemorrhagic cyst. It could be endometriotic cyst as well. But then again, depends upon your symptoms. If you are symptomatic, you have having severe pain, abdomen, you'll have experiencing pain while having intercourse or pain while passing urine or while, passing stools, then it requires treatment. It doesn't require surgery per se. For a 3 centimeter cyst, I would say that medical management is as good as anything. So you might be okay with the medical management if you are symptomatic. So
Right.
that needs to be done.
Right. Right. So keep an eye on it. Get your, and how, what's the duration of repeating a test, ma'am, once you know that you have a cyst? Size monitor करने के लिए.
Yeah, so usually for the smaller cyst, if we know that what kind of cyst it is, we might not bother to get them checked again. But if usually for the simple cyst or the functional cyst or the follicular cyst, we'll ask them to get an ultrasound repeated by 3 to 6 months. If some other cyst is there which have some vascularity, some echos, or like the hemorrhagic or the endometriotic cyst I'm talking about, then we usually get it done 6 monthly to see the response to the medications if we give them. So it is
Right.
again, there is no set guideline per se, but varies from patient to patient.
Right. Next question is Geetanjali Nagpal, जिनका 31-year-old है. 2-3 months से period में the blood flow is not proper. Only 1 or 2 drops for the first 2 or 3 days. Is this a serious concern?
Well, any period which is lasting less than a day or you are not using pad beyond 1 day, 1 pad per day or something like this requires evaluation. So you might be having some hormonal imbalance right from the level of LH-FSH to maybe the progesterone estrogen. So everything needs to be checked and accordingly treatment could be given. So we call it
Right. So
hypomenorrhea and definitely require treatment and evaluation.
okay, so do get a consultation done, Gitanjali ji, and we will leave a link to consult Dr. Monica as well. But it's important to get your consultation done. Right.
Yeah,
Next question that
exactly.
I want to take up is about Arpita Roy. Overweight after delivery, is it common or any other reason? I know we all suffer with this.
Yeah, that is there. Again, it all depends upon how physically active you are. Once you resume to your, normal activities, your exercise and diet and everything, you can take care of the same. So this is
Yeah.
something, depends upon your physical abilities and what you are doing. Even you tend to gain weight after delivery because you'll have so energy dense foods and for the lactation purposes and everything, and you'll be resting most of the times, so it is normal. You should not be bothered much about it, but once you think that you're ready, you should get back to your exercises and healthy lifestyle and everything
Right.
whenever you are ready. I mean, there is no harm in getting fat, but then it's always a good option to stay healthy.
Correct, correct. So next question that I want to take up is PC Shalini Verma, 36-year-old. Ovarian cyst है, dermoid cyst बोला जाता है उसको. What is a dermoid cyst? 4.7 centimeters. Is it harmful?
Yeah. So dermoid cyst is again, as I was telling before this thing, that it's kind of cyst in which there is many layers of cells are there, which leads to the formation of they are actually embryological cells जो पहले हमारे बनते हैं एंड इवेंचुअली बहुत अलग अलग जगह से सेल्स आ गए हैं और उनसे जैसे कि मान लीजिए उसमें यू कैन गेट tooth, a part of tooth, a fragment of bone could be there, hair could be there, such kind of thing. We call it immature teratoma, kind of, in the scientific terminology. So dermoid cyst is something which will contain a foreign body inside this, in this some sebaceous material or pus like material, I mean sebum material would be there inside. So what happens is dermoid cyst usually causes pain and causes much inflammation and everything. So dermoid cyst, if you know it, like usually it is diagnosed on a basis of ultrasound or CT, MRI. If you have been given a diagnosis, it will keep on increasing in size as well. You'll experience severe pain all of a sudden, and then it becomes an emergency. So it's better to tackle electively rather than going for an emergency thing. And the cyst, like as you said, 4.7 or 5 centimeters, whatever it is, the size, it definitely requires a treatment. Unfortunately, there is no medical management available for this thing, because nothing will dissolve this cyst, because there are formed elements inside. I mean, it's not fixed that you'll have a tooth or a hair or something. It could be anything. So that needs to be taken out. So as to
Oh,
save the other remaining ovarian tissue, it's a good idea to take care of this thing. Otherwise, it will grow big in size.
wow, that is an important, ma'am. While we talk about removal and planned surgeries, you are an expert in robotic gynec surgeon. You are an expert in your
Right.
field. So, what is the newer treatment that we are able to offer now?
Yeah, so basically, initially these emergency settings, once the patient bleeds or there is so much of blood or any rupture happens, we used to do then open surgery in which we have to cut open the abdomen. Then the pedestal of laparoscopic surgery came, which is done enormously done everywhere, in which we just put a small incisions over the abdomen and get in with the scopes and take it out. Now, the added advantage of now the best is the robotic surgery. The added advantage of the robotic surgery is the incisions are the small as there in the laparoscopic surgery, but the ease with which we can do the surgery and the confines of the spaces, where the narrow pelvic spaces where we cannot reach out through the laparoscopy or even with our naked eyes, because it is very deep inside. The pelvis is a very narrow space. So this robotic platforms allows us to reach to those narrow crevices, and with the camera and everything, and we can take that out, especially in the females which who are unmarried or younger, in which fertility preservation is an issue. We need to be very, intricate in doing the surgery so as to not to harm the neighboring tubes or the uterus or the conva. So we need to be very precise in doing the surgery when once we say that we need to preserve the fertility for, conception in the future. So with this
Right,
robotic
ma'am.
platform, we can offer that surgery, because it has the magnified vision which even our naked eyes cannot see, and the suturing wherever it is required, like specifically in the cases of myomectomies in which we take out the fibroids. So we requires meticulous suturing in those things, otherwise which will, impede the conception in the future. So that could be done fantastically with this robotic approach. And the blood loss is hardly anything, hardly 2 teaspoon, I would say. Even in the major to major surgery, I'm not talking about the cancer surgeries, but even for these surgeries, it is very small amount of blood loss is there, and patient is fit to go after 6 hours or 8 hours of the surgery itself, when we are talking about
Won-
ovarian cyst management itself. So of
Wonderful. So,
course
it
it
is
is the
actually
latest one.
known to both the performing
Obviously.
surgeon as well as the
Exactly.
patient. Yeah,
Yeah, and it depends upon the hands of the surgeon. It's the surgeon's expertise which counts the most whenever a surgery is being done. So
correct.
this allows us to perform the surgery in a much better and efficacious way as compared to the other modalities.
Wonderful, ma'am. Pleasure knowing that you perform a number of surgeries using the robotic surgery procedure. Thank you so much. One more
Yes.
question here. अहेली बाल पूछ रही है, बहुत important question है lean PCOD के बारे में. Please do talk about PCOD management in young lean women with only irregular cycles and no typical other PCOD symptoms like insulin resistance, acne, or excess hair. There's nothing in our case.
Yeah, so there is this entity which is the lean PCOD, in which the patients will not be fat. So they don't have the insulin resistance signs as she spoke about. But if you have the irregularity in the periods, we need to give you the treatment. I mean, irregularity in the sense that you are getting periods maybe once every 3 months, of 2 months, 2 or 3 months, or beyond that. Then you'll require some hormonal pills for the same. And the lifestyle modification, it's not about only losing weight, it's about the healthy diet and exercise and the physical fitness. That applies here for the lean PCOs as well. So that goes hand in hand with this. And The hormonal therapy or the medications which we give for PCOD can be continued by the time your body takes over and will be able to wean you off from that medication.
Right. Thank you, ma'am. And one last question that I would want to ask is Shimna, 43-year-old female. If the ovarian cyst is large, should I undergo complete uterus removal too to avoid other issues in future? Because I've heard that it will also affect the uterus slowly. Is it true, ma'am? Are they both linked?
No, actually, cyst per se, now again, the characterization of the cyst is very important. If we are talking about a cancer or a suspicion of a cancer, then a female who has completed her families or something like this, the complete surgery would be recommended. But if it is just a simple cyst, then just taking out of that cyst or maybe that side of the ovary will do. I mean, we usually leave the second ovary as well because it has a function to play in those females. I mean, even after menopause, I mean, because if we take out the other ovary as well, she'll undergo premature menopause, and that will take a toll on her heart health, her bone health, and everything. So,
Yeah.
just by the fear of this, that she might develop cancer or might develop any problem in other organs, doesn't mean that to take that out. I mean, हम ये सोचकर किडनी तो नहीं निकाल देते हैं कि उसमें भी कैंसर बन सकता है. So that is the thing.
Right.
I mean, if we think that it is a malignancy or something, then we do take out the whole thing. But then depends
Yeah.
upon what kind of cyst it is.
Okay, wonderful advice there, ma'am. So before I conclude, I keep saying last question and वो कभी last question नहीं होता है मेरा. There are two people who are asking about simple cyst है, do I need to get it removed? And Sukanya says ovarian endometriosis size 1.5, do I need to get it removed? So one last time, please do tell us simple cyst के
Yeah.
बारे में क्या कर सकते हैं.
Simple cysts, as I told, usually require just follow up or might require no treatment at all. Simple cyst usually resolves on their own, might require some medical management or the hormonal pills if the size is bigger or it is symptomatic. But smaller ones do not require any treatment. Again, for the endometriotic cyst, as she said, 1.5 centimeter, it is very small. If she is not symptomatic, nothing needs to be done. But yes, close follow up is definitely required.
Great, ma'am. Thank you so much, Dr. Monika Meena. Now, I would want you to give us some tips to take care, to identify, and then manage ovarian cysts. Top tips, please.
Yeah. Yeah. So now, as I said, the emphasis of good food, the first thing is the good diet or the healthy diet, have the portions of good carbohydrates, proteins, fats, everything is required. It's better to cut down the carbohydrates to keep more of a, sabzi ko zyada rakhiye rather than chawal or roti ko kam rakhiye. So good diet is very important. Cut down on your processed food, the cheese or the burgers or pasta, pizzas, the carbonated beverages, cut down upon the same. The second thing is exercise. It's a good idea to exercise to stay fit. So, to start with, 30 minutes of brisk walk is a very good idea. Good amount of sleep, at least 8 to 10 hours of sleep is a good thing. Try to maintain a nice diurnal rhythm, because these are the factors which eventually affect other health as well. But of course, they are being talked about directly about the ovarian health. Should avoid smoking. Smoking is directly, connected to the risk of progression of ovarian cancers. So smoking should not, I mean, you should avoid or completely, I mean, stop or quit smoking. The other thing is the warning signs. If you have those warning signs like the pain abdomen with profuse discharge, any intermenstrual bleeding or irregular bleeding, or the menstrual irregularities like the periods are delayed by 2 to 3 months, or if they comes every 20 days or so, you have severe pain abdomen, you have some symptoms like abdominal distension, bloating, you have pain while making out, or you have pain while passing urine, some menstrual problems are there, then you need to reach out to your gynecologist for timely help for your assessment of the conditions and ultrasonological evaluation if the need be that your gynecologist will assess.
Thank you, ma'am.
So these are some modifiable risk factors which can be taken care. for your ovarian health. While of course there are some non-modifiable or the hereditary risk factors are there which we cannot avoid, but again the timely pickup will aid in the diagnosis and further management of the same.
Yes.
So
Thank you, ma'am. Thank you so much, ma'am. While I say the last question, Prakriti has just joined and asked one important question, which I cannot miss. Is this hereditary? Can it pass from parents to children? And two, fibroid and cyst के बारे में क्या फर्क है? So quick, ma'am,
yes, yes.
30 seconds answer, please.
Yeah, yeah. So usually ovarian cyst per se, I would say we have it runs in the family in the sense that there is a hereditary predisposition in the forms of if the ovarian cancer is there in your sister or in your masi or the female relatives, your this mother side of the family, you might be predisposed for the same. So ovarian and the breast cancers are the ones which are predisposed in the family. It runs in the family. There are 10 to 20% chances that you might be harboring some mutations, genetic mutations are there, and some syndromes are there which runs, because of which the ovarian cancers may develop. Even the cyst, though it is not documented, but yes, they do run in family. I mean, if your mother might have this thing in her lifetime, you might be predisposed to the same. So again, this thing is something which you cannot avoid. This is the non modifiable risk factors, but the risk factors which you can take care of is something which needs to be worked upon. The second question is the difference between a fibroid and the cyst. So fibroid is a tumor or the outgrowth which happens in the wall of the uterus, and cyst usually is a fluid fill like structure which happens in the ovary, in the neighboring ovaries which is there. So fibroid is associated with the uterus most of the times, and cysts are usually in the ovaries.
वंडरफुल मैम, थैंक यू। प्रकृति कहाँ थे? इंपॉर्टेंट क्वेश्चन लास्ट में पूछ रहे थे आप, बट थैंक यू फॉर आस्किंग दैट क्वेश्चन। एंड डॉक्टर मोनिका,
Yeah.
अब तक आप हमारे सवालों के जवाब दे रहे थे, थैंक यू। अभी मैं क्वेश्चंस पूछने वाली हूँ। आई एम गोइंग टू आस्क माय ऑडियंस हेल्थ क्विज। ऑल द वुमेन आउट देयर, गेट रेडी। डॉक्टर साहब ने बहुत सारे क्लूज भी दे चुके हैं मैम ने, सो आई विश ऑल ऑफ देम पार्टिसिपेट। बट थैंक यू सो मच मैम, आई विल टेक लीव फ्रॉम यू राइट नाउ। थैंक यू फॉर दिस वंडरफुल इंफॉर्मेशन।
Thank you so much, Jhansi, for having me over. And it was a
Thank you.
wonderful interaction with the audience and with you. It was a pleasure
Yes,
answering all
ma'am.
the questions if it have been
Thank you,
any
ma'am.
help.
थैंक यू मैम। सो चलिए फटाफट तीन क्वेश्चन पूछ लेती हूँ। यू हैव टू आंसर these questions only on YouTube chat. Winner's name will be announced towards the end of the show in another few minutes. Winners will be selected at the sole discretion of Apollo 24/7 team. And if I take your name to be a winner, you have to write back with all your contact details, that is your name, phone number, address, etc. To this email ID, marketing@apollo247.com. You have to write before Wednesday of every week. Gift vouchers will be shared with you. So here are the three questions I'm going to place on the screen. Here are the questions for this week. Fill in the blanks. Ovarian cysts are growths that develop on or inside your blank. What is it? It starts with O blank A R blank E S. What is the blank there? Ovarian cysts are growths that develop on or inside your what? Question number two, true or false? Ovarian cysts can cause emergencies. Is that true or false? Ovarian cysts can cause emergencies. Is that true or false? Question number three, yes or no में answer दीजिए. Most ovarian cysts do not cause symptoms. Yes or no? Most ovarian cysts do not cause symptoms. Is that true or false? These are the questions for this week, and I'm waiting for your answers. Madhu and Prakriti, you have answered. Okay, let's see. Lavanya has also come. All of you, while you're answering, go ahead, type your answers in the chat box, and I'm going to give you health coupons right now. The health coupons that you can use on Apollo 24/7 are Ask Doc 150, ASKDOC 150. ये code लिख लीजिए. Consult top doctors direct from Apollo hospitals and get 150 rupees cash back on online doctor consultation. And the next one that we are giving away today is First 3, FIRST3. Use this code to get 25% off on online medicine orders when you order medicines from Apollo 24/7. You get first 3 is the code that you have to use, and you know that you get a 2-hour delivery when you order with Apollo 24/7 as well. The next one that we give away for our Health Hour viewers, which is an exclusive code, is HH247. If you have Apollo 24/7 and you can use this HH247 as a Health Hour viewer, get 199 off on online consultation with Apollo doctors and get 20% off on medicine orders as well. This is in addition to the other coupons that we have shared. So go ahead, download Apollo 24/7 and use these coupons. And by the way, Apollo 24/7 can be accessed through WhatsApp as well. It is as simple as texting or calling on WhatsApp. Save this number 9355 247 247 to avail healthcare services just like the app. You are just a call away or a text away. And next week, we are going to talk about an important topic: how to keep your kidneys healthy. Yes, these are the organs which are the filters. So please do understand how to keep your kidneys healthy. Join us 28 January, 11 a.m. We are going to bring you a nephrologist to the discussion. So next week, we are going to talk about this. But this week, I'm waiting for our okay, let's see who's all participating. Madhu, Tamanna, Sukanya. Okay, let's see who the winners are. The winners are, oh yes, Madhu, Tamanna and Sukanya. Congratulations, you are the winners. You are the people who have participated and you are the winners. Madhu, Tamanna and Sukanya. Do please write back to us at marketing at apollo247.com with your name, phone number, email ID, etc. and then claim your prizes before Wednesday. Your mail needs to reach us. फिर मिलते हैं next हफ्ते. Every Sunday we come with this edition. So thank you all of you for joining us this Sunday with your questions. Every question is important. Namaskar.